The medical surgical nurse evaluates a patient who suffered a head injury 24 hours earlier and observes the emergence of slurred speech and a loss of sense of time and location. The nurse's first move is to A. Prepare the patient for emergency surgery. B. Continue the hourly neurologic assessments. C. Inform the neurosurgeon of the patient's status. The most typical abdominal surgery problem that can be avoided is A. Fluid and electrolyte imbalance. B. Thrombophlebitis. C. Atelectasis. D. Urinary retention. A nurse failed to administer a medication to a patient according to accepted standards. Consequently, the patient suffered adverse effects. Failure to provide patient care and to follow appropriate standards is called A. Breach of duty. B. Breach of contract. C. Battery. The main ways that nursing diagnoses differ from medical diagnoses are as follows. A. Primarily concerned with psychosocial parameters, while medical diagnoses are primarily concerned with physiologic parameters. B. Primarily concerned with human response, while medical diagnoses are primarily concerned with pathology. A customer who had suffered an amputation is being urged by the nurse to put on a prosthetic right away. The benefit of taking this quick action is A. Better fit of the prosthesis. B. Ability to ambulate sooner. C. Less chance of phantom limb sensation. Before being released, a patient with a fractured left leg must learn the three-point gait. Which directive ought the nurse to deliver to this patient? A. Move your right crutch and left foot forward together, and then swing the right foot and left crutch in one movement. B. Using one movement, advance your left foot and both crutches and then bring your right leg forward. The nurse's most accurate explanation of a thyroid scan to a colleague is that it A. Measures the effect of TSH on thyroid function. B. Demonstrates decreased uptake of radioactive iodine in areas of possible malignancy. C. Demonstrates increased uptake of radioactive iodine in areas of possible malignancy. Shauna was diagnosed with gastroesophageal reflux disease following an EGD, GERD. Edna is taught by the nurse how to reduce symptoms. Which of the following Edna statements suggests that more instruction is required? A. I will be sure to drink tea instead of coffee. B. I will sleep with the head of the bed elevated about 12 inches. In a negligence suit against a nurse, what must the plaintiff prove? A. The nurse intended to cause harm. B. The nurse's actions caused harm. C. The nurse knew she caused harm. D. The nurse was sorry for causing harm. The central venous pressure, CVP, of a patient who has congestive heart failure and acute pulmonary edema is continuously monitored. Which of the following describes a successful treatment plan for the client? A. Central venous pressure decreases. B. Central venous pressure increases. The main goal of treatment for acute glomerulonephritis is to A. Encourage activity. B. Encourage high protein intake. C. Maintain fluid balance. D. Teach intermittent urinary catheterization. Nursing diagnoses mostly differ from medical diagnoses in that they are A. Primarily concerned with caring, while medical diagnoses are primarily concerned with curing. B. Primarily concerned with human response, while medical diagnoses are primarily concerned with pathology. To prevent a common, adverse effect of prolonged use of phenytoin sodium, dilantin, patients taking the drug are instructed to A. Avoid crowds and obtain an annual influenza vaccination. B. Eat a potassium-rich, low-sodium diet. C. Practice good dental hygiene and report gum swelling or bleeding. During an assessment of a patient who sustained a head injury 24 hours ago, the medical surgical nurse notes the development of slurred speech and disorientation to time and place. The nurse's initial action is to A. Continue the hourly neurologic assessments. B. Inform the neurosurgeon of the patient's status. C. Prepare the patient for emergency surgery. For the evaluation feedback process to be effective, the medical surgical nurse who is a manager A. Conduct weekly meetings with staff members. B. Inform staff members regularly of how well they are performing their jobs. C. Provides goals for staff members to meet. To prepare a patient on the unit for a bronchoscopic procedure, the medical surgical nurse administers the 4 sedative. The nurse then instructs the licensed practical vocational nurse to A. Educate the patient about the pending procedure. B. Give the patient small sips of water only. C. Measure the patient's blood pressure and pulse readings. Which physiological response is often associated with surgery-related stress? A. Bronchial constriction. B. Decreased cortisol levels. C. Peripheral vasodilation. D. Sodium and water retention. A patient's family does not know the patient's end-of-life care preferences but assumes that they know what is best for the patient under the circumstances. This assumption reflects A. Justice. B. Paternalism. C. Pragmatism. Which statement by a patient with diabetes mellitus indicates an understanding of the medication insulin glargine, Lantus? A. Lantus causes weight loss. B. Lantus is used only at night. C. There is no peak time for Lantus. Which action occurs primarily during the evaluation phase of the nursing process? A. Data collection. B. Decision-making and judgment. C. Priority setting and expected outcomes. D. Reassessment and audit. Which action best describes a sentinel event alert? A. Documenting the breakdown in communication during a shift report. B. Indicating that a community or institution is unsafe. C. Signaling the need for immediate investigation and response. Which is primarily a developmental task of middle age? A. Learning and acquiring new skills and information. B. Rediscovering or developing satisfaction in one's relationship with a significant other. C. Relying strongly upon spiritual beliefs. D. Risk-taking and its perceived consequences. A patient became seriously ill after a nurse gave him the wrong medication. After his recovery, he filed a lawsuit. Who is most likely to be held liable? A. No one, because it was an accident. B. The hospital. C. The nurse and the hospital. It is hospital policy to assess and record a patient's pulse before administering digoxin, lanoxin. By auditing the nursing records to determine the frequency of compliance with this policy, the Quality Assessment and Improvement Committee is conducting A. A process analysis. B. A quality analysis. The nursing diagnosis for a patient with a myocardial infarction is activity intolerance. The plan of care includes the patient outcome criterion of A. Agreeing to discontinue smoking. B. Ambulating 50 feet without experiencing dyspnea. C. Experiencing no dyspnea on exertion. A nursing department in an acute care setting decides to redesign its nursing practice based on a theoretical framework. The feedback from patients, families, and staff reflects that caring is a key element. Which theorist best supports this concept? A. Erickson. B. Watson. Which statement by a patient demonstrates an accurate understanding of herbal supplements? A. Herbs may interact with prescribed medications but not other herbs. B. There is no standardization among the manufacturers of herbs in this country. For a patient with Crohn's disease, the medical surgical nurse recommends a diet that is A. High in fiber and low in protein and calories. B. High in potassium. C. Low in fiber and high in protein and calories. D. Low in potassium. When examining a patient who is paralyzed below the T4 level, the medical surgical nurse expects to find A. Flaccidity of the upper extremities. B. Independent use of upper extremities and efficient cough. C. Impaired diaphragmatic function requiring ventilator support. After completing a thorough neurological and physical assessment of a patient who is admitted for a suspected stroke, the medical surgical nurse anticipates the next step in the immediate care of this patient to include A. Administering tissue plasminogen activator. B. Obtaining a computed tomography scan of the head without contrast. The first step in applying the quality improvement process to an activity in a clinical setting is to A. Assemble a team to review and revise the activity. B. Collect data to measure the status of the activity. C. Select an activity for improvement. D. Set a measurable standard for the activity. Which of these comments, if made by Mrs. Warren before her surgery, would indicate that she had concerns about her body image? A. I will have to stop my aerobics classes. B. I'm so afraid I may not survive the surgery. C. I need to go shopping for some loose, baggy clothes. The nurse receives all of the following stat orders from Mr. Palmer. Which one should the nurse question? A. Oxygen per nasal cannula at 4 L per minute. B. Troponin level. C. The nurse should question the order for Lovenox because the patient is receiving a heparin drip. Mrs. Clark is prescribed metoprolol tartrate, low pressure, for hypertension. Which symptom of hypoglycemia would be masked by low pressure? A. Diaphoresis. B. Tingling. C. Tachycardia. In the event of a fire in a hospital's dialysis unit, which of these actions should the nurse take first? A. Extinguish the fire if possible. B. Activate the fire response system. C. Confine the fire by closing all fire doors. D. Remove patients or staff in danger. A patient who has active pulmonary tuberculosis, TB, states, "I'm not going to take these TB pills." Which of these responses by the nurse would be appropriate? A. You need to sign a refusal of treatment form. B. You should know that the health department can require you to take the medication. When a patient is having a chest tube removed, which of these instructions would be appropriate? A. Take short, quick breaths with your mouth open. B. Take a deep breath and hold it. C. Breathe only through your mouth. D. Breathe as you normally do. Sing the average cost of a problem and the cost of intervention to demonstrate savings. A. A cost-benefit analysis. B. An efficacy study. C. A product evaluation. D. A cost-effective analysis. In Erikson's psychosocial model of development, which stage is typical of those entering young adulthood? A. Identify versus role confusion. B. Initiative versus guilt. C. Ego integrity versus despair. D. Intimacy versus isolation. To prepare a patient on the unit for a bronchoscopic procedure, a medical surgical nurse administers the 4 sedative. The medical surgical nurse then instructs the licensed practical nurse to A. Educate the patient about the pending procedure. B. Give the patient small sips of water only. C. Measure the patient's blood pressure and pulse readings. Which action best describes a sentinel event alert? A. Documenting the breakdown in communication during a shift report. B. Indicating that a community or institution is unsafe. C. Signaling the need for immediate investigation and response. Which is primarily a developmental task of middle age? A. Learning and acquiring new skills and information. B. Rediscovering or developing satisfaction in one's relationship with a significant other. C. Relying strongly upon spiritual beliefs. D. Risk-taking and its perceived consequences. The nursing diagnosis for a patient with a myocardial infarction is activity intolerance. The plan of care includes the patient outcome criterion of A. Agreeing to discontinue smoking. B. Ambulating 50 feet without experiencing dyspnea. C. Experiencing no dyspnea on exertion. When examining a patient who is paralyzed below the T4 level, the medical surgical nurse expects to find A. Flaccidity of the upper extremities. B. Hyperreflexia and spasticity of the upper extremities. C. Independent use of upper extremities and efficient cough. When prioritizing a patient's care plan based on Maslow's hierarchy of needs, the nurse's priority would be A. Allowing the family to see a newly admitted patient. B. Ambulating the patient in the hallway. C. Administering pain medication. Which measure most effectively reduces the risk of healthcare-associated infections? A. Keeping employee health records up to date. B. Performing hand hygiene. C. Providing annual influenza vaccinations. D. Always wearing a mask when caring for patients.